Have you ever thought about your blood? I mean, really thought about it? It's like this incredible delivery service, a biological superhighway that carries everything your body needs to every single cell. It's so efficient we usually don't even know it's there. That is, until something goes wrong.
So what does happen when that vital delivery system starts to break down, especially in a child? What if the very thing that's supposed to sustain life actually becomes the source of a crisis? Well, that's the reality for kids with certain blood disorders, and that's exactly what we're going to unpack today.
We're going to pull back the curtain on two of the most significant pediatric blood disorders out there, sickle cell anemia and hemophilia. We're going to get right to the heart of what these conditions are, the challenges they bring, and most importantly, the incredible ways they're managed.
So here's our game plan. We'll start with a look at blood's unseen battles. Then, we'll zoom in on sickle cell and its risky shape, and what happens when it goes into crisis mode. After that, we'll switch gears to a totally different issue, hemophilia. And to wrap it all up, we'll look at the toolkits used for managing both of these conditions.
All right, let's kick things off with blood's unseen battles. See, these conditions aren't about a broken bone or a cut you can see. They are intense internal struggles happening at a microscopic level. Battles that require a ton of strength and some pretty sophisticated medical care to fight.
So, let's dive into our first deep dive, sickle cell anemia. With this condition, the whole entire problem comes down to one single critical detail, the actual shape of the red blood cells. So what is it exactly? Well, sickle cell anemia is basically a group of inherited diseases. The main problem is with hemoglobin. That's the protein in your red blood cells that carries oxygen. Instead of the normal, healthy stuff called hemoglobin A, people with the disease get an abnormal version called hemoglobin S.
And this picture, this says it all. Up top, you see those nice, round, healthy red blood cells. They're like cars cruising down an open highway, no problem. But on the bottom, that's what happens with hemoglobin S. Under the right, or should I say the wrong conditions, these cells warp into this rigid C shape, like a sickle. They become like big, broken-down trucks, causing a massive, painful traffic jam in the body's tiniest blood vessels.
And that traffic jam we just talked about, well, it has a name. It's called a sickle cell crisis. This is a sudden, extremely painful episode that happens when those sickled cells block blood flow, literally starving tissues of the oxygen they need to survive.
So, what kicks off this crisis mode? It's usually triggered by anything that lowers the oxygen levels in the blood. We're talking about things like a fever, not drinking enough water, or even major physical or emotional stress. Any of these can start that sickling process and boom, you're in a crisis.
Now, there are few types of crises, but this one, the vaso-occlusive crisis, is by far the most common. This is literally that traffic jam. The sickled cells pile up, they block circulation, and the surrounding tissue gets starved for oxygen. And that lack of oxygen, that's what causes the terrible pain and swelling.
But a blockage isn't the only danger. Sometimes the problem is where all that blood ends up. In what's called a splenic sequestration crisis, a massive amount of blood actually gets trapped and pools in the spleen. This is incredibly dangerous. It can cause the spleen to get huge and lead to a sudden severe drop in blood volume, which can send the body into shock.
And while some crises are about blood getting trapped, others are about the cells themselves just breaking down way too fast. That's a hyperhemolytic crisis. Those fragile sickled cells are destroyed so rapidly that the body just can't keep up with making new ones, leading to severe anemia and jaundice.
And in one last really alarming scenario, the body's own production line can just stop. In an aplastic crisis, which is often triggered by a virus, the bone marrow suddenly stops making red blood cells altogether. As you can imagine, that leads to a life-threatening form of anemia.
Okay, deep breath. We are now going to pivot to a completely different kind of blood disorder, hemophilia. If sickle cell is like a traffic jam on the highway, hemophilia is like having no road crew to patch up any leaks. It's all about a problem with clotting.
So let's make this super clear, because this is the key difference. Sickle cell anemia is a problem with the shape and function of the red blood cells themselves. Hemophilia, on the other hand, has nothing to do with cell shape. It's a problem with the blood's fundamental ability to clot and stop a bleed. Two very different issues.
So what does that mean, exactly? Well, hemophilia is a group of inherited disorders where the body is missing or is deficient in certain proteins called coagulation factors. You can think of them as the first responders to an injury.
The two most common types are hemophilia A, where you're missing factor 8, and hemophilia B, where you're missing factor 9.
So what does this actually look like in day-to-day life? Well, it can mean bleeding for a really long time after even a small cut. It can mean frequent, intense nosebleeds and bruising super easily. But one of the most serious signs is bleeding into the joints. This isn't just painful in the moment, it's incredibly destructive over time, causing swelling, stiffness, and even permanent damage.
All right, so with these really serious challenges, how are these conditions actually managed? This is where we get to the good stuff. Let's look at the proactive toolkit that healthcare providers and families have at their disposal.
So how do you fight a sickle cell crisis? It's a full-on, multi-pronged attack. Hydration is job number one, both drinking and through an IV, because it helps thin the blood and get those cells moving again. Oxygen can help stop more cells from sickling. And of course, aggressive, around-the-clock pain management is absolutely critical. On top of that, you encourage a diet high in calories and protein to help the body build new cells, and you do everything you can to prevent infections, which are major crisis triggers.
And here's a super important safety note from the source material. A common pain medication, meperidine, is specifically avoided. Now, why is that? It's because when the body breaks it down, it creates a byproduct that can build up and actually cause seizures. That is a devastating risk you just can't take with an already vulnerable patient.
Now, the action plan for hemophilia looks totally different. The number one treatment is replacing that missing clotting factor. When a joint bleed happens, it's all about RICE: rest, immobilize, ice, and elevate. And one crucial step, always, is to assess for any signs of an internal head bleed, doing a neurocheck, because that is a true medical emergency. And of course, a huge part of management is prevention, like avoiding high-contact sports to prevent the injuries in the first place.
You know, sometimes the most powerful interventions are the simplest, and this is a perfect example. A medical alert bracelet is just non-negotiable. In an emergency, it instantly tells first responders what's going on, ensuring that child gets the right care and avoids any treatments that could actually make things worse. It's a lifesaver.
So the big takeaway here is that managing these complex conditions is absolutely a team sport. It's this incredible partnership between doctors, nurses, and families, all working together to stay one step ahead. It's a mix of cutting-edge medicine, smart lifestyle choices, and the power of genetic counseling, all to empower families with knowledge and control.
And that leaves us with this final, really hopeful thought. These conditions, yeah, they're written into a child's genetic code. But that code doesn't have to define their destiny. It really makes you think, doesn't it? How can the power of early diagnosis, dedicated science, and proactive care transform what was once a devastating blueprint into a truly manageable journey?